Okay. Before I talk about the healthcare system, okay, the structure and apparatus of healthcare system in the United States, I'd like to give a brief introduction about challenges that our healthcare system is facing. There are a couple of major issues in the public debate about healthcare delivery in the United States, including the rising cost, the equity, right? Whether people have equal access and equal opportunity to get quality care. And third one is this geographic distribution or unequal geographic distribution of healthcare services. Okay. Recent health reforms or healthcare reforms have endeavored to address, not all of them, but at least some of these issues, right? By promoting better access to health insurance, okay, and wide access to, better access to health insurance is critical for increasing the quality of care, right? Improving the quality of care is because access to health insurance is very important. Okay, and research findings have shown that previously uninsured persons had worse health and used more service when they became eligible for Medicare coverage at age 65. So it is about access, right? And second, uninsured are more likely to hesitate before seeking treatment, even in emergencies, thus exacerbating their existing health problems. Okay, so let's look at the rough picture about this issue of rising costs. Okay, so the per capita healthcare expenditures in the United States are the highest in the world. In 1980, this number, per capita expenditure, was $1,100. In 2007, that number skyrocketed almost 7-fold to 7,681. And in 2020, the number even grew to a staggering 12,530, almost double, right? That's unimaginable, the increase. And here is a graph published a couple months ago at New England Journal of Medicine, probably the most prestigious journal in medicine across the world, has a very large impact factor above 50, and believed to be the highest, most impactful journal in the world. So in the United States, the healthcare expenditure as a percent of GDP has been on a rise since 1950, right? From hovering around 5% to 20%, if I remember the most recent statistic. It is 20%. So on a relative term, this is a huge number. And also, last graph is just kind of self-comparison over years, so time series comparison with ourselves. And how about international comparison? Let's say compare, healthcare expenditure as a percent of GDP in the United States, compare with that percentage in other not third world countries, but industrialized nations. So let's go to this healthcare system tracker website, okay? And so let's look at this graph, right? Okay, and this graph tells us, relative to the size of its economy, the U.S. spends a much greater amount on healthcare. So on the x-axis, horizontal axis, we have GDP per capita, right? So it shows, on average how the economy performs. And on the y-axis, we have health spending per capita. And probably it's not going to be shocking to figure out that United States is this outlier situated far away from this line. This is called regression line. So any point that is on this line or close to this line indicates that in a performance of a particular country roughly follows the average pattern. So the United States here, roughly speaking, that's 2020, PPP adjusted. United States has a GDP per capita of $63,487, but its health spending per capita is way above average. Okay, so any point that's above this line means, the Y deviates largely from average. If the point is below this line, this is called the regression line, so conditional mean, right? Below the regression line, that means given the economy size, the economic size of a country, okay, turns out, healthcare expenditure is, per capita is relatively small, given its, size of economy. So United States, given its size, on average, it spends a lot more than other countries. People might be interested in, let's say there's another outlier here, and we can check that out, and that country is Ireland. So given its, size of economy, Ireland should be spending around here, right? Its Y should be close to 10K. So let's say 90, let's say $9,000, 9K, but it's way below. Okay, it's $5,604 given its size of economy on average. But United States, given its size of economy, it overspends. And here we can pick another country. Let's say Finland. Okay, so it is roughly on the line. That means given its size of economy, its healthcare expenditure, it is right around where it's supposed to be. And let's look at a couple other countries that are located above the regression line. Okay, they're only slightly above the regression line. So here we have France, it only overspends a little bit, right? And also United Kingdom. Know that France and United Kingdom, okay, provide literally free healthcare, and given their size of economy, they only spend, they spend only a little bit above their average. Okay, so United States overspends a lot. And let's look at another table, bar chart. On average, other wealthy countries spend about half as much per person on health than the United States, right? Again, the United States tops the ranking, right? The second one is Switzerland, right? $7,138 per person. Okay. so again, almost every single graph we would see that United States not overspent a little bit, but by a considerable margin. Considerable margin. Okay? And now let's go back to our slides. So people are going to ask, what could be some contributing factors for this rising cost? Staggering, right? And jaw-dropping increase. Right? A couple of things, according to our textbook. And later on, I'm going to bring up a couple others. First is aging of the population, right? Because baby boomers are entering their retirement. And here I'm talking about the latest generation, the latest cohort of baby boomers. And when we talk about baby boomers, we're talking about people who were born between 1946 and 1964. And if we just study let's say people who were born in late in early 1960s, they're approaching very close to be 60s, and they're around the time in which baby boomers need a lot more health care than when they're when they were much younger, right, in their 40s and 30s, right, or 20s, right. Second is increasing hospital expense and doctor fees. Okay, no doubt about it. And then third factor is increased cost of health insurance. Again, fourth is increased use of and advertising for prescription drugs. Prescription drugs. So big pharma here accountable, right? Here it's not like single out, but we say, well, for advertising use of prescription drug, but R&D for big pharmas. Okay, the salary, the bonus, okay, etc. Increased cost of health insurance, so related to an insurance company, and doctors' fees, expenses. So it is about healthcare professionals. And so here, unlike other healthcare systems in the world, here I'm talking about industrialized world. Okay, United States have major stakeholders, except patients, that are for profit, except the patients. Okay,